Causes of erectile dysfunction, things that cause ED, erectile dysfunction. Okay, so in this video I will talk about low dopamine. Okay, so dopamine is a major modulator of sexual function, and also it blocks prolactin. Okay, as we know, prolactin lowers testosterone, inhibits DHT formation via 5-alpha reductase inhibition, and reduce libido and erection. Okay, so there is inverse relation between dopamine and prolactin. Okay, so prolactin also reduces dopaminergic function in specific region. Okay, so also dopamine is thought to regulate erection by acting on oxytocin containing neurons. Okay, so dopamine plus oxytocin means better erection. Okay, so even without nitric oxide synthase, high level of dopamine can induce erection. Okay, so how we can increase dopamine? Okay, if we want to restore, we need to have things like 9-NBC or bromontane. If you need my help, you will find the link for my coaching. But generally, you can do it via amino acid like phenylalanine, tyrosine. Okay, but we need to have proper functioning of BH4. Okay, we need to have B vitamins. Okay, proper level of iron, proper level of certain vitamins. Okay, so the second thing is DHT. Okay, so DHT has a lot to do with 5-alpha reductase and androgen receptor sensitivity. It means all these things are connected. Okay, so without androgen receptor sensitivity and density, you will not get proper response to your testosterone. Low DHT mean your penile tissue will suffer. Okay, smooth muscle will be affected, nitric oxide directly in your penile tissue will be affected, and even 5-alpha reductase enzyme in your penile tissue will be affected. Also, it has negative effect on adrenergic 1-alpha receptors. Okay, so you need to boost DHT. The proper ratio between DHT and testosterone is 10:1. Okay, so 1000 testosterone, 100 DHT. Okay, nanogram per deciliter. Okay, so another thing, inflammation, oxidative stress. The worst thing can happen. Okay, so you really need to consider oxidative stress as a main contributor. Okay, so the first thing I will focus on is oxidative stress and inflammation. Okay, so you need to take a look at oxidative stress because it lowers BH4. It's important for dopamine and for nitric oxide. Okay, so it will also decrease our nitric oxide availability in our body. Okay, so I also don't talk about smooth muscles in your penile tissue. You will have small dick. Okay, so we need to definitely fix inflammation, oxidative stress. There are many great antioxidants that we can use for this reason. Okay, so sympathetic dominance, or if you have sympathetic nervous system dominance, okay, it will inhibit erection and it will shorten the ejaculation time. Okay, you will have PE. Okay, so noradrenaline, adrenaline have really negative effect on these alpha-1 adrenergic receptors. Okay, so therefore things like trazodone or tafuzocin, they can help a little bit with this negative effect, or noradrenaline. Okay, so we can also use supplements that can help reduce sympathetic tone in our body. Okay, so another thing, extremely important, okay guys, IGF-1. Okay, so just one thing, okay, Clomid and Clomiphene, in longer run they will decrease IGF-1. Okay, so therefore some guys, they don't see effect on erection because they will decrease IGF-1. IGF-1 even in PFS guys is extremely important. It supports also 5-alpha reductase. Okay, so low IGF-1 means bad erection. Okay, so folate B12, B vitamin, and homocysteine. Okay, so folate and B12 are reducing homocysteine, and also they are involved in nitric oxide cycle. Okay, so it's extremely important. I prefer to supplement with whole B vitamin complex, okay, instead of just taking B12 or B9. Okay, so drugs. I already had one video talking about drugs. There are many drugs that will cause a lot of issue. Really big one, dutasteride, finasteride, ketoconazole, okay, ketamine, opioids, SSRIs, okay, certain antibiotics, okay, even blood pressure medication. You just need to switch to better choice, okay. So if you need my help, you will find the link for my coaching. High blood pressure, okay, so we need to more of ACE2, okay, so we don't want to have a lot of angiotensin 2 in our system, okay, because it will release aldosterone and all these kind of things. So the proper choice of anti-hypertensive drugs is important because we will boost our erection and also we will lower the blood pressure, okay. There are also natural way how to lower blood pressure, okay. Biggest one, hyperlactin. We already talked about inverse relation between dopamine and prolactin. Prolactin will kill your erection, will kill your testosterone production. In some guys, there are two things important. Prolactin reset. It means you need to keep prolactin as low as possible. Okay, so like when I did prolactin reset, I kept my prolactin around 4. Okay, so everything between 4 and 7. Okay, and this is how you will restart the whole system. Okay, so because prolactin will block your gonads. Okay, that's it. Okay, so everything probably about 20-25, even 11-15, I don't know. Okay, so if you have low dopamine, okay, it can have really negative effect. Okay, so you need to fix prolactin. That's it, guys. Let me know what you think, and if you need my help, check the description.